Our lovely patient, who's 72 years old, is
Roberta.
3 months out.
3 months out.
She's 3 months out from surgery, and she comes in today, and she's very graciously agreed to share some of her thoughts and feelings about how she's doing, how she feels about her results, and what she's looking forward to in the future.
I am so excited about my results. Everybody loves it, but more important than that is I feel like a new person. I mean, first of all, I've lost 10 pounds since this, having nothing to do with the surgery, but it just felt, everything in my life just felt brighter, and I go, yeah, I'm going to lose this weight. So I did that too. And I was
not on any kind of medication or anything?
No, I just went like, I'm feeling so great that I'm just gonna work on the whole thing. I'm going to the gym because I just feel different. I feel happy. Yeah. I feel younger.
I love it. And when we look at your pictures here, your before and after pictures, what jumps out at you?
A jawline.
Yep.
I have a jawline again.
Yeah. It used to go from basically your chest up to your chin. Now it comes up and you can see your beautiful neckline and your jawline. And really the smoothness of your skin.
I know, I'm wearing different clothes again.
Wow.
I mean, yeah.
The whole package.
It's everything. Well, that's why I said I lost a few pounds, after the surgery just because I didn't feel like eating. And then I just go like, man, I feel so great. I just kept going. And you know what, Dr. Claytor, I know I said this to you earlier, but I'm going to say it again, is I would not have done the surgery had I not met you.
Wow.
You were the third surgeon and I talked to, and the first two I went like, this is too scary, I can't do it. And I met you and I went like, that's it, I'm doing it.
And we did it under local anesthesia.
Local anesthesia, which was not bad at all. People freak out when I tell them. I don't know, really.
I've the editors from Allure magazine are.
Oh my God! Look at that.
Yeah, look at we're looking at before and after pictures.
I really got to have that, even though I don't want to see that first one.
We're looking at before and after pictures here, and how would you describe your before picture?
Yeah, like my mother.
Okay, and how would you describe you now?
I'm excited and happy, and I feel beautiful
and
young.
Look at you! Just look fantastic.
I know. I'm really happy.
The editors from Allure magazine they don't want to talk about doing this operation under local. I keep offering. I've written a paper of my last 200 patients that I've done. And they keep shying away from it. And there are some surgeons out there who have words for doing this under local that aren't very flattering and aren't endorsing of this. And certainly there are individuals who don't do it under local. So therefore, it's hard. How do you have somebody talk about a procedure that they can't or don't do? But they are more than happy to. But it's wonderful to have you and many of the other patients I've operated on share their experiences so that if somebody wanted to have this done under local, that option exists for them.
Well, let me tell you something important.
Please.
3 weeks after the surgery, 3 weeks, I went to my daughter's 50th birthday, which was a big event. 3 weeks. I did not look like I had surgery. I did not look like anything. I walked in, I go, I'm 3 weeks after, and they go, you are not. I go, yeah, I am.
Well, I will frequently tell people at 1 week you're out and about at the grocery store. Was that true?
Mm-hmm. Absolutely.
And then I'll say at a month, you can go to a wedding, but not your wedding.
Well, I went to my daughter's at 3 weeks after.
So you were even ahead of the curve.
I was. And I'll tell you something, I felt confident. I felt fantastic. I wore a low-necked dress.
Wow.
Well, my chest looked so good.
Yeah, it does.
And I felt fantastic, and nobody knew. And I have one more thing I have to say. My daughter, it was the first time she saw me, and she didn't even say hello. She said, oh, thank God. I said, what? She goes, I was afraid you were going to look different. You just look like you, but younger. My daughter.
At 50, her 50th birthday, she says to you, thank goodness you just look like you, but younger.
Yes. She said, oh my God, Mom, I didn't want to tell you, but I was so afraid.
This is I just
I'm
can't
shocked.
get over
I'm still shocked looking at it.
This picture.
I know.
I know.
It's pretty shocking. I hope she sent me those too.
Well, we can send these to you.
I've got to have them.
If you have an iPhone, we can airdrop. We can email these to you.
But anyway, yeah. If my daughter, she said, I did not want to be like, I didn't want to hurt your feelings, but I was really scared. You were going to walk in the door and look like somebody different. She said, you just look younger.
So great.
I know.
That is so great.
I'm happy.
Well, you look fantastic.
So
you have a brightness and an excitement in your eyes that is piercing and penetrating. And
I'm happy.
And you can see it in your cheeks and in your smile and just the brightness in your eyes.
We didn't even do anything with my eyes, but they look better because I think all of the tissue's pushed up.
Exactly. Sometimes you don't need to do your eyes. Just as you said, if you can reset your cheek and reestablish that cheek volume, that addresses it. And again, you're 72 years young, and I think you look very age appropriate. You don't look, nobody would look at you and be shocked if they thought you were in your 60s. But you don't look, sometimes I think individuals can push it and make themselves look not in alignment with who they are.
Exactly. Well, she was afraid that my face was all going to be like pulled back. She just was afraid I was going to look different. And she said, "Oh, thank God."
That's just one less thing she has to worry about on her 50th birthday.
I know. Yeah.
So
thank you so much, Dr. Claytor.
Well, you're so wonderful to share your experiences, and I appreciate it.
I would have done it if it weren't with you.
Well, you're wonderful. I always like to ask, my last question is this something that you would recommend to a friend?
Oh, I have.
Oh, thank you.
I tell everybody who asks. In fact, a woman who has already met with you, I won't give you her name, but she is coming to my house to see the results this afternoon.
Oh, I love it.
She's already met with you.
This
is the last thing.
This is the last thing. Well, I don't know who it is, but I am very grateful. How did you get connected with her?
Somebody I knew, it was their cousin, and they go, "You got to talk to my cousin. She's seeing Dr. Claytor." I said, "Okay." I talked to her on the phone before she came to see you.
Yeah.
And then she said, "Can I come and see you?" I said, "Yeah, sure. I'm happy to be a walking representative."
You're such a star.
I am. Thank you.
Oh, gosh. Well, I'm very grateful, and I appreciate your generosity and your kindness and your wisdom.
Well, thank you so much. Have a good day.
Yes, thank you.